welcome back. Today we are discussing pregnancy and pediatrics. Very common topic that we get a lot in chiropractic, and so we want to just touch bases on a few of the most common questions that we get. So the first question I want to cover is going to be about how long should I see my chiropractic for, and can I see my chiropractor when I'm pregnant? Well, the answer is yes, I can see my chiropractor when I'm pregnant. It's a very common thing for women to have back pain, sciatic pain, SI joint pain, those types of things when they are pregnant. And it's something that we can help with a lot. As for how long you can see your chiropractor, you can see your chiropractor pretty much up to the date of the birth of the child. It's really just a matter of comfort for the patient. And does the chiropractor have the proper equipment? Do they specialize? Is it a part of their practice for the patient to lay on the table and be comfortable? So it's really all about that. Another question that we get often is, why should I see my chiropractor when I'm pregnant? I discussed a little bit about that with, SI joint pain, sciatic pain, just discomfort in the low back and mid back, especially from holding yourself up when the pregnancy is a little bit further advanced, tends to have some back pain associated with it. Whenever you're healthy and your spine is healthy and you're in less pain, you're going to sleep better, you're going to rest better, you're going to have less pain. That's all less stress, less cortisol, all of those things. Since you are basically the mothership for that child, what affects you does affect that baby. Not just in your diet, but how you're feeling physically with pain and fatigue and those type of things. So really, chiropractic is a great benefit for pregnant women, and it's something that you should consider, especially if you're having any type of back pain, sciatic pain, discomfort, those other type of things. The next common thing is pediatrics. Such a hot topic today, and we're going to really talk about the young athletes and children as they grow. But first, let's address the infant. Boy, I'm done with my pregnancy, now I've got this infant, it's going through a couple months, and they're just struggling to sleep, they're not comfortable, they don't seem like, they're colicky, and although there's a lot of other treatments that are out there for that, chiropractic should be one of the ones that you consider for it. One of the reasons is the spine is traumatized in birth. Most babies handle it fine, they recover, it's not a problem. If your child is struggling as an infant to get over that or to have that digestion or sleeping well and just doesn't appear comfortable, chiropractic should be one of the things that you consider for that. Since the lower lumbar spine and the mid lumbar spine affect digestion directly, it can be of benefit. And of course, treatment for an infant is vastly different than what we see for an adult or a young child even. So again, there are chiropractors out there who have this as a part of their general practice, and there's chiropractors who actually specialize in this. Seek out one of those people. Call, talk to your chiropractor, see if they are one or know one. It's a great question to ask them. So next, toddlers. Boy, why does a toddler need to be treated? Well, toddlers fall a lot. They fall off of beds, they fall off their bikes, or when they're learning to walk, they're constantly falling over. Those things can create trauma in the body. One of the big things that we see is at that time frame, we're potty training. The bladder is controlled by the spine. So if you are struggling with potty training, it could be something as simple as some adjusting that helps the body, the toddler's body, gain better control over what's happening with them and what they're trying to learn. Neurologically, they're trying to teach their body, when do I feel pressure? When can I hold those things? How do I exercise control over that? They're not thinking that, but their body's going through that. And the spine is a big part of that process. So you should consider that. If your toddler is having trouble sleeping, potty training, those type of things. Next, the young athlete, or really the young child and the young athlete. Such a vast difference from today. The athletes are being trained at such a young age now, at such a high level with programs that we've developed. We've brought programs down from the college and pro-college and high school. We're teaching middle schoolers different little things that they can do to become a much more elite, much higher class athlete at those very, very young ages. And really, it's another time where scoliosis screening is really taking place for those athletes and those young children. And that is absolutely something that should be done. We're going to talk about scoliosis and treatment options in chiropractic and other types of options that are very effective in another video. But this is the time when they should be starting to be screened for that, because this is when their body's changing, it's growing, it's stretching. All of these things are happening while they're really learning to use their body and become more coordinated. So that neuromusculoskeletal system that's all tying together at this age is something that should be considered important to care for. Chiropractic is one of those things that you want to add to that care. Plus, chiropractic is used in sports for prevention of these injuries, and at such a young age, that is a big thing. We don't want to just treat people when there are athletes when they're injured. That really affects their play, their time of play, how they feel, their motivation. So prevention at a young athlete's age is something really to be considered. Weekly, every other week, monthly, those type of patterns are great for young kids and young athletes. That's all the time we have for today. If you want more information on this or other topics, please visit DocShay.com or call your local chiropractor.